All right, let's dive straight into this explainer. We're looking at the real science behind ASMR and chronic pain today. We see this content absolutely everywhere, right? Soft whispers, rhythmic tapping, and it's so often packaged with these bold, flashy titles promising a literal miracle cure for your physical aches and pains. But today, we're going to strip all that internet hype away. We're looking strictly at what the clinical research actually shows us, completely ditching those miracle cure claims. So, to map out our journey today, we'll be covering coping, not a cure, why chronic pain is complex, what the research actually shows, gate control theory, and we'll wrap up with a safe ASMR pain test. Okay, section 1. Coping, not a cure, managing expectations. First up, we really need to address the elephant in the room regarding those massive promises you see online. It's a huge question, isn't it? Can ASMR actually help chronic pain? Well, the careful, science-backed answer is it may absolutely help some people cope with their pain, but it absolutely, positively should not be presented as a cure. We really have to separate that temporary feeling of comfort from the actual medical definition of healing. There is just this massive gap between internet hype and scientific reality. On one side, you've got the hype, right? Promises of direct healing, complete pain relief, immediate cures. But on the flip side, we have the grounded reality. ASMR is a potential tool for comfort, nervous system regulation, and symptom coping. Think of it as a supportive instrument to help you cope, not some magic wand that's going to just erase the underlying issue. Moving on to section 2, why chronic pain is complex. Let's really understand pain. Because to understand how something as simple as auditory triggers can help, we have to deeply understand the pain itself. And chronic pain? It's incredibly complex. It's rarely just one isolated thing. It's shaped by this massive web of overlapping physical and mental factors. I mean, we're talking about tissue injury and inflammation, sure, but also severe nerve sensitivity, chronic sleep disruption, and the incredibly heavy burden of fear, stress, and mood. Over time, these factors actually cause structural changes in how your nervous system functions and processes attention. It is a full-body, full-mind experience. So the crucial takeaway here, and please hear me on this, is that your pain is not imaginary. It is completely 100% real. But because it's shaped by the brain and the body working together, heavily involving your nervous system's interpretation of signals, sensory inputs, like ASMR, might actually have a very real physiological role to play in how you manage it. All right, section 3, what the research shows. Let's look at the scientific evidence. Let's look directly at the evidence and break down the studies to see exactly what ASMR can and cannot do for us, based on the actual data. We've got 2 foundational pieces of research here. First, Poerio and colleagues in a 2018 study found that in ASMR-sensitive viewers, ASMR actually reduced heart rate and improved a calm mood. Second, a 2015 study by Barratt and Davis noted that viewers primarily use ASMR for relaxation, sleep, and mood support. Now sure, these studies don't directly prove pain relief in a strict clinical sense, but they are absolutely crucial. Why? Because tension, high heart rates, and sheer exhaustion fundamentally make pain worse. If you can lower your heart rate and actually get some decent sleep, you are putting your body in a significantly better position to handle discomfort. And this brilliantly illustrates the core mechanisms at play here. So how does ASMR actually support pain coping? First, through attention. Pain aggressively demands your attention, right? ASMR gives your brain a safe, alternative signal to follow, literally reducing the mental bandwidth you have available to focus on the pain. Second, relaxation. As you listen, your muscles soften. This physical softening reduces your body's overall feeling of threat and dials down the emotional intensity surrounding the pain. And third, sleep. Chronic pain and poor sleep form this terrible vicious loop where each makes the other worse. Helping with a gentle sleep onset breaks that cycle, supporting much better pain coping the very next day. Let's shift to section 4, gate control theory. Let's dig into the neurological science. To really understand the science of why this works on a neurological level, we need to look at a classic idea in pain science. It's called gate control theory. Basically, it's the concept that non-painful sensory input can sometimes reduce the transmission or perception of pain signals in the nervous system. Now, this high-level neurological definition essentially means that introducing a new, completely safe sensation can effectively close a gate in your spinal cord. It blocks some of those distress signals from ever reaching your brain. Your nervous system gets busy processing the safe input instead of just focusing on the painful input. Think about it this way.
It's exactly why rubbing a bumped elbow immediately helps it feel a little better. I mean, unless you hit your funny bone, which we all know is entirely devoid of humor. But normally, you're flooding the area with non-painful sensory input. The rubbing, the warmth of your hand, which intersects those pain signals. Now, ASMR belongs to this broader idea. It's certainly not the same as physical touch therapy or a TENS machine, but it provides that safe sensory input through sound and visuals that can legitimately change your overall pain experience.
But let's pump the brakes for a second. We must be entirely honest and cautious here. ASMR is not a pain treatment. If your pain is new, if it's severe, worsening, or unexplained, you absolutely must seek proper medical evaluation. If your pain is affecting your daily life, you deserve a real, comprehensive medical treatment plan designed by professionals, not just an ASMR video you found online.
Okay, Section 5. A safe ASMR pain test. Let's try it at home.
Now that we know ASMR can safely sit right beside professional care as a comfort tool, let's explore how to actually use it in your daily routine. Here's a fantastic, safe framework you can try at home. Step 1. Start by choosing a low-volume ASMR trigger that you already know you enjoy. Step 2. Make sure you lie or sit in a highly comfortable, fully supported position. You don't want your muscles doing any extra work to hold you up. Step 3. Just listen for exactly 10 minutes. And step 4, this is the most important part. Rate your physical tension, your level of fear, the pace of your breath, and your pain intensity, both before and after you listen. By following these steps, you can safely track whether ASMR is actually helping you rest and regulate your nervous system, rather than setting yourself up for disappointment by expecting some magical cure.
I love this quote. Sometimes the win is not pain gone. Sometimes the win is I can breathe around it. This shift in perspective is everything. It's incredibly powerful. ASMR is really about helping you feel less alone in your body. It's about calming your nervous system just enough to find the space to cope, to breathe a little easier, and to just rest. So, I'm going to leave you with this provocative question to consider the next time you put your headphones on. Does ASMR help your pain directly, or does it mostly help you relax around it? I strongly encourage you to observe how your own body responds using that safe test we just discussed. Thank you so much for joining me for this explainer. I really hope it gave you some clarity and a bit of comfort. Take care of yourselves out there.